Zakia, you back on? Zakia. Zakia, how are
Hello.
you? Sorry.
Good.
Sometimes the internet goes down at my house, my parents' house. Okay. So we were talking about bartholinitis. Okay. So yeah, it's just an inflammation of those glands in the vaginal orifice. And then obviously we can treat these with antibiotics because it's bacterial based.
Bacterial based.
Yep, it's closely associated with an STD, and it causes arrhythmias, edema, pain, purulent discharge, fever, malaise. And it can also form a cyst. So if those continue to stay blocked, they'll form a cyst behind that blockage in the gland.
Okay.
Okay, that's that one. Okay, ready for round two? Here we go.
Yeah, I'm just like reviewing after you. I will put like a yellow highlighter on it because leiomyoma. Okay, it's a cancer. It's a benign tumor, right?
Yep. Where's it at?
Leiomyoma. I think. Well, according to the menstruation, that will be in the uterus.
Yeah, it's in the uterus, right? It's a benign tumor that's in the wall, the muscular wall of the uterus.
The muscular wall of the uterus. Okay.
So how would we treat this guy?
I think it's that benign is a tumor,
Yeah,
so it need to be removed. That will be the what's the tractomy? No,
hysterectomy, but we could just you don't have to do a complete hysterectomy to remove a leiomyoma, but they do a lot of times. And then also ask yourself this question: if it's in the menstruation side, if it's on the menstruation side, what activates this? When is it more active? When does it hurt a woman the most?
I think during the menses. So, or during the hormone secretion, right?
There we go. Anytime the hormones in your reproductive system are active, anything in the menstruation side is going to be more active and more painful, right? And it's going to cause discomfort, and that condition can happen. So leiomyoma, it may not be caused because of menstruation, but it's in the uterine wall, and it's most active during menstruation because the uterus contracts and expands during menstruation. Yeah. As well as like during childbirth, right? Because this is not normal muscle tissue. It's a cyst. It's a benign growth. And so, again, those are the two times it'll be the most active, and the true treatments are hysterectomy to physically remove it. Or if a woman has one of these and she goes into menopause and she stops menstruating, she may not have to have the leiomyoma removed because the hormones that cause the uterus to contract and relax are gone. They don't secrete anymore.
Oh yeah. Because she doesn't have any menses coming up, so there is no hormone. There is no hormone producing. So
and there's no need for her to have this removed if she's at that point in her life.
Okay, great. Okay. So does she? Okay, good.
Awesome. Okay, round two. Here we go. Okay, you ready?
Oh my gosh, yes. Oh, the priapism. Wait. I know the Peyronie's.
Yep, Peyronie's.
They have to put.
Yep, our nasty uncle.
There is an implant that need to be put in the penis.
Yep.
But the priapism is the abnormal erection of the not abnormal, like a prolonged erection.
Oh, it's abnormal. Yep, it's abnormal. How long does it have to be erect for it to be abnormal?
4 hours. Over 4 hours.
Yep, over 4 hours.
Okay, over 4 hours. Yes.
Okay, there you go. How do they treat this one?
I think not synthesis. What do you call when you put the?
They gotta suck it out. They gotta get a needle and suck it out. So it's a centesis. Yes.
Centesis. Okay.
Pulling the fluid out. So it'd be like penile centesis.
So what's the it's just pain. The side on a side will be pain, and then if that goes over for hours, what's the consequence?
The consequences are necrosis, right? The tissue in the penis is
Necrosis.
going to start to die because the blood's not moving, and so it's not getting any oxygen, and the waste materials aren't taking out. So they'll start to poison themselves, and necrosis will happen. And then, like we always talk about, when you have necrosis, you have the tsunami, right? It starts with one cell. That cell dies. It releases its internal components, and it starts to kill the ones next to it. And then,
Oh yes,
and
yes.
yeah, so we get the wave of death, and the wave of death is in the man's penis this time, which would make him really, really unhappy.
Okay.
Okay, ready? Round 2. Here we go.
Okay. Let me highlight it. Highlight it. Okay. Inguinal hernia is so it's a weakness in your abdominal wall that led the some of your intestine to bulge out of your some of your intestine will bulge out like out of a hole. I don't remember what the whole name.
Where's the hole? How it causes the hole?
Oh, is it the inguinal hole? No, it
Not
has
the
a
inguinal
name.
hole. It has a name. What causes there to be a hole or weakness in the inguinal hernia? There's a structure that has to happen in order for that to have a hole in it.
I don't remember it.
The testicle. As the testicles descend when a child in a baby, when they're first born, the testicles will start to descend, and as they descend through the inguinal hernia, they cause that hole to be created in the inguinal hernia or in the inguinal ligament, and that hole becomes a weakness for the intestines to be able to slip out when a guy bears down.
So is the inguinal canal? Is
Yep.
that what they call it?
Yep, we call it inguinal canal.
Oh.
Now that's normal, right? The inguinal canal is normal. That's where the testicles descended through. A hernia is where the small intestines have descended through that inguinal canal, and they become herniated in the inguinal ligament, and that's the problem.
In the inguinal ligament, a hernia in the inguinal ligament. Okay.
So how do they treat this? What do they do to treat this?
I think they need to push it back.
They can manually push it back in, and that's the first primary treatment. What happens if it keeps descending through that hole?
Well, you'll get all your what they call that your large intestine out.
Well, they surgically go in and repair it by putting a mesh over the inguinal canal, and that keeps the small intestines from descending back down through there. They put a mesh, a little wire looking net they put over that hole, and that keeps the small intestines. It reinforces that spot and makes so the intestines can't descend through there.
Oh, okay.
Okay.
So is that okay? So how this weakness happen? Is just by aging, or like
it's not aging. It's just when the testicles descend from up in the abdomen down into the scrotum, they go through the inguinal hernia and make the inguinal canal. And that's just normal biology. That's just as a young man maturates and matures after childbirth, the testicles just descend.
Okay.
That's normal. Great. That's normal. And then the inguinal hernia is the abnormal. It's because the small intestines start to descend through those holes, and they either need to be manually pushed back in, and the guy needs to change his lifestyle, or it needs to be surgically repaired.
Okay.
Okay. Round 3. Here we go.
Wait. Oh. So BPH is an age-related dysfunction. That's one. Second, we will have just enlarge of the prostate, and that will affect urination, causing the urine to go backflow to the kidneys and cause the kidney failure.
Yeah, well, yeah, it can cause kidney failure, but its most common side effect is that it just causes a UTI. It's like a urinary tract infection for a man, and then if it continues long enough, then it develops into kidney failure.
Yeah, and it's related to aging. So the prostate is like enlarged.
Yep, every man will get this. Like if a man lives long enough, he'll eventually get benign prostatic hyperplasia or hypertrophy. So let me ask you this question. So how do they treat this? What do we do to treat this thing?
Let me think.
Call Roto-Rooter. That's the name.
I don't know. Wait. I don't know. So how they solve the problem with the urination, because they have not oliguria. No, they just they because it's a UTI, so they have urgency to go to the bathroom.
Yep, urgency. They have a hard time exiting all the urine out of their bladder. It's difficult for them to pee, and it can be painful for them to pee.
And they're like it's mostly during night, right?
It's just whenever, because now these gentlemen, they have it all the time. Their prostate's enlarged all the time, so they have those symptoms anytime they need to urinate. It's not any particular time. Anytime they need to urinate, they're going to experience all this stuff.
So treatment.
So how do they fix this? Don't cheat and look at your notes. Think about it.
Okay.
You know what to do here. So they have an enlarged prostate that is never going to be reduced. We can't give a medication for this. It's not infection. So what do we got to do to fix this?
I don't know. They need to fix how they will like be urinating again.
It's surgical. They go in there and they use either a catheter to open this up and to open the prostate back up, or they physically have to go up there with a drill and drill it open. They physically have to remove part of the prostate cells to open the urethra back up.
Oh.
Okay, so if they're doing that, if they're going in there with a drill and they're opening that prostate up, is there a chance the doctor can make mistakes and damage the prostate?
Yeah.
Yeah, so incontinence and loss of sexual performance are two of the big side effects of that surgery. And so they're really careful about how they give it. They'll do everything they can up to cutting that prostate. They don't like to get in there and do any adjustments, because the doctor can damage the prostate when he's doing that. But the alternative is the guy gets sepsis from urinary infection and kidney failure, and he dies. So that's the alternative. So yeah, they'll go in and they'll fix this if it gets bad enough.
So catheter or surgically intervene?
Yep, they surgically go in there with a drill and fix it. Okay, moving along.
Okay. Bacteria. Okay, so bacteria are our most or like the faster growth pathogen. So it's like
they're just fast growing. Yep, that's their big thing.
Yes.
Can bacteria be treated? Can bacteria be treated?
Yes.
How do we treat them?
Antibacterial or antibiotic?
Yep, antibiotics. Good. That's it. That was an easy one, right?
Yeah, that was easy. Thank you. Oh, human papilloma virus. Okay, so those causes the what they call that thing in your mouth and your vaginal simplex?
That's her. No. This is not herpes simplex.
Not? Oh no.
Think about cervical cancer.
Yeah.
Think about cervical cancer.
Oh yeah.
So HPV or human papillomavirus is directly linked to female reproduction through cervical cancer. Why? What's the relationship between HPV and cervical cancer in women?
Well, what I can remember, I know that causes that.
When this virus is present, it increases the woman's risk for cervical cancer.
Oh.
And how do we check for that? How do we check for HPV on the cervix?
I don't know.
Pap smear.
Okay.
So Pap smear. So cervical cancer.
Yeah.
Cervical cancer and HPV and a Pap smear. Okay.
I'm just highlighting. highlighting.
You're okay. That's why we're doing this, because if you can't generate this stuff out of context, right? I'm not saying on test day you won't be able to think. I mean, what I'm saying is, yeah, I don't care if you remember all the viruses to remember the one that you're working with in the question, but that's very energy intensive, right? It's very energy intensive to remember all this stuff, every single question. So don't do that. So do what we're doing now, where we're randomly picking terms at random, and you either know it or you don't know it, right? At this point, you either know about it or you don't. And if you don't know, This is an invitation for you to start digging into your notes individually and start to learn the things that you need to learn on your own. Like we've done study group. Now it's time to do, now the study group is showing you what you know and what you don't know.
Yeah, that's why I like my study group.
Okay,
you see,
that's why we do this.
Yeah, everything that I know now is from this side, from the slide. I didn't even go over my notes.
Okay, and there's nothing wrong with that. I'm just saying though that maybe you now want to start digging into your notes, because just from the slide, I identify a term on the slide and you're struggling to remember stuff about it. Now you may want to put the slide up with your notes, read the notes, and look at the slide or whatever. You know what I mean? Like start to do that and do that on your own, right? That's something that the study group, you need to do that now. Does that make sense? In order for you to get the most out of your study, you need to start doing some of that.
Yeah, for me, because like you forget what you hear in the lecture. Yep. It's good for me to know some stuff in my head before I go to the paper, because if I go to the paper and see like I don't remember anything, I get frustrated. But with this, oh yeah, I know what they're talking about.
Yeah, it jogs your memory a little bit. Yep.
And then I can go faster in my notes, like, and that would not make me feel like frustrated. It's
less boring too. Okay, ready?
Yeah. Yes.
Here we go. Round 3. Here we go.
Our tricks. Okay, so the
Okay, sorry, Zakia. Keep going. What are you saying? My dad's replacing the modem. That's what's wrong with the computer.
Okay, so the tricks are the most common reason that women can go and visit the doctor, and it's
not just women.
Oh, that's what I thought.
Remember, trick is the gateway sexually transmitted disease, right?
Yes.
If you get this one, all the rest of them are easier to get. So it's not just women; it's men. Men and women can get this.
Oh, okay. So
let me ask you a question about trichomoniasis or trick. Is this a true sexually transmitted disease? Is it truly a sexually transmitted disease, trick?
I don't think so. But
why not? How else can we get this? Can you get this other ways without getting it through sex?
Is that the one that you can get from like swimming in the river?
Yeah, you can get it from dirty water, and so you can have you could have an 8-year-old kid come into the doctor with. I mean, it could be at their genitals, right? But they could get trick in their genitalia. They're 8 years old. Clearly, they're not participating in sexual activity. Yes. You know what I'm saying? Unless they're being abused, which would be totally different. I'm just saying, if you have a child who presents with trick, who hasn't been sexually assaulted or anything, then you know they're getting it from another water source. And that's an area to be educating parents, right? Hey, listen, your kid got trick. Oh, okay, they were swimming up in the reservoir in Riverton, right? Okay, don't take your kid back to the reservoir, and now you're making a call to the health department. Does that make sense? Because you're telling them, hey, I had a patient come in today. They had trichomoniasis, and the parents told me that their kids had been swimming up at the reservoir in Riverton. There may be an outbreak of trick. There may be trick present in that water. Then the health department goes up and checks it. If they find trick in the water, what are they going to do? They're going to close that reservoir down for everybody until they get the problem worked out in that water source. Okay. So that's why trick is the gateway. And again, obviously, trick is also spread sexually. So if someone has it, and they're having sexual activity with someone else, they're going to give it to them. But the person who originally got it may have gotten it from dirty water. Okay. I can do this one. Okay, we good? Great. Okay, that is your review on that. Now we're going to move on to Unit 12. So I've got the questions right here. I've already answered them. I think you already answered them too, didn't you? Yeah, we did. You know, that day after, on Tuesday. So we sat and we go over the 30 questions, and we had 2 questions that we've been struggling with. Actually 3. One is about that number. Let me bring my book. Well, let's just go through them now. Oh yeah. Let's start going through them now. We can go through them together. You can see how I answered them. Yeah, let me bring mine so you know what we answered to. Okay, that's fine. Okay. Yep, sure. Yep.
Okay.
Okay, so what did you get for number 1?
Okay. Okay, for number 1, we get D.
Okay, let me ask this question then before we move on. Just as review, what's A? What does A actually mean? What's the definition of A?
Let me remember. Osteomalacia. What Howla said about that.
This is soft bone disease.
I think
it's soft bone. Soft bones.
It's just soft bones?
It's soft bone disease, right? So that means soft bone.
You see, in our lecture, we didn't go like name by name. We'll be just thinking what will be the dysfunction is, and we go over the notes. We didn't like really break down what's the osteomalacia, but I remember Howla said it.
Yep, just like in Unit 11 when we went through the definitions, and I didn't really go through the definitions, did I? We went through the medical terminology, which drove the definition. So this is true too. So osteo means what? Anytime you see osteo, what does that mean?
Bone.
It means bone, right? So Malaysia means soft bone. Okay, so osteoporosis. What does osteoporosis mean then?
It's just like a spongy bone.
Yeah, porous. It means to have an opening, right? So open bone, right? Porous means open, so open bone. What's osteoarthritis?
I think that's inflammation in your bone.
It's swollen joints, right? Swollen bone or swollen joints. So swollen bone. Okay. Osteogenesis imperfecta. So osteo means bone, right? That's what that means. What's genesis mean?
I think genesis is to produce, or
it's like the beginning, right? The beginning.
The beginning,
Yep. And then imperfecta, well, imperfect. So it's saying that the bone is imperfect at the beginning.
Okay.
That's what that means. So if you look at the actual definition in the manual, it's on page number. It's on page number. Where's this at? Oh, let's see here. Dang it. Osteomyelitis, osteopenia, osteoporosis, osteoarthritis. And it is on page number 8. And if you look at it, it says osteogenesis imperfecta. It means brittle bone disease, the most common hereditary bone disease. It means that it's genetic. You inherit this from your family. And the way that it affects you is it's autosomal, which means that it's an autoimmune problem, right?
For osteoimperfecta?
Yeah, osteoimperfecta, it says autosomal, dominant type 1 and 4, and autosomal recessive type 2 and 3. The pathology, the biochemical defect is the ability of the bone to synthesize collagen around the bone. Abnormal collagen results in incomplete bone development, ligaments, and sclera. So some children will have a light blue colored sclera. Brittle bones will result in, when varying degrees and fragility, different types of OS, or osteo, that's bone. OI is a bone. Different types of bone are worse than others. So different areas of the body get this worse than others. It says signs and symptoms, bone fractures for babies, even during birth. So osteogenesis at the beginning, imperfecta, imperfect bones. So that's why you're getting baby and infants getting broken bones at birth, and during childbirth, because their bones are already brittle, and it's when they're born. Short, bowed, deformed limbs, short stature, cervical curves, and blue sclera in their eyes. Treatment: treat fractures, protect the bones. IV osteoporosis medications, aldronate, and that's Forzamax. Same med used for osteoporosis treatment.
So what the IV do here? IV osteoporosis?
So you're basically pushing in your IV treating. You're giving them by IV Forzamax, and Forzamax helps the bones to uptake calcium.
Okay.
You're treating osteoporotic bone, or bone that has a hole, or it's not completely full. You're giving it a treatment or a medication that helps it to take up calcium and to form more completely and to get harder structure. Okay. So that's how you treat it. So again, if we know the medical terminology, osteomalacia is infected bone. Osteoporosis is porous bone, and it's porous, it's got a hole in it. Osteoarthritis is swollen bone or joints, and then osteogenesis imperfecta at the beginning, the bone is imperfectly formed. And the way that word is made, it tells us the definition. Does that make sense? It kind of points us in the right direction. So we don't have to remember what's going on, right? So in question number 1, if I was going to rewrite question number 1 for it to be osteoperfecta in osteogenesis imperfecta, I'd say a baby during childbirth has broken bones. Like that, that's how the question would start, right? During childbirth, little Susie had 2 broken femur bones in her legs when she was delivered from her mom's during childbirth. What disease is this? Right? Does that make sense?
That would be osteogenesis
imperfecta, right? So what if I if I was going to write this for osteoarthritis, I'd say Mrs. Jones, who's 72 years old, chronically has pain in her both of her hands, large knuckles at her index finger, but she chronically sews. She's been sewing on a sewing machine since she was 3 years old. That makes sense. That's overuse, right? That's osteoarthritis. And so it's say, what disease does this lady have? That's osteoarthritis. And osteomalacia is, Jimmy, the 22-year-old football player, he got a broken bone when he's riding his bike a year ago. And now, by the way, he got a staph infection, and now he's got staph infection in his bone. Right? It's moved to his bones in his leg where the break was. What disease is this? Well, that'd be osteomalacia.
Okay. So osteomalacia is just soft bone.
I'm sorry. Yes, you're right. I'm sorry. I apologize. Osteomalacia is soft bone. Will you forgive me? I totally said that wrong.
Yeah, it's okay. So it's like
osteomalacia. Yep, it's yeah. Osteomalacia is soft bones. Osteomyelitis is infected bone. Osteomyelitis.
Myelitis.
Yes.
Osteomyelitis. Okay, yeah.
Yes, I apologize.
Osteomyelitis.
Yep, that's it. Okay, you good?
Okay.
We already move on?
That's me. You see, I'm listening to you, Chris.
Well, no, again, it's going to be easier to recognize and answer those questions if you know the medical terminology than it is just to remember a bunch of random stuff.
Yeah, I know.
Right? I mean, you can read the chapters and remember random stuff all you want, but you can get confused. But if you look at the definition and you look at the word and how it's written, that right there is going to dispel a whole bunch of stuff for you. Does that make sense? By knowing what the medical terminology is, then you're not worried about, is it for kids? Is it for adults? Is it an old lady? Is it a guy? Right? If you put the definition, it's gonna narrow it in. If
you put them if you break that down, like those disinfection, like those dysfunctions by age, the same way that we did for the cell damage, is that will be like by number, by size, by age, like this. So if we put all the dysfunction related to age together, then that will be easy to differentiate them, right?
Well, yeah, no, and you can do that, right? We could differentiate these out. The problem is that not all of these ones differentiate out like that. Can anybody get a bone infection equally? Yeah, that one you can't separate by age because it's not age-based. But osteoporosis, you could do osteoporosis by age and by gender. Because who's most likely going to get osteoporosis?
I think women, because they lose a lot of
women. It's older women. They're going to be the ones that are going to be most susceptible to osteoporosis. Not to say that a younger woman who was, say, malnutritioned, or a younger woman with an eating disorder couldn't get osteoporotic bone and have spontaneous fractures. It's just less common.
Less common. Okay.
It can still happen. It's just less common. Okay. So that's one of those things where it's people I know, and I'm the same way. I want hard and fast rules, right? I want hard and fast rules that I can always grab onto and always be right. Class, if this class has taught you nothing, there are only a few hard and fast rules in this class, and the rest of it is all how you interpret the findings the patient presents with. Does that make sense? Because you could have a 39-year-old woman with osteoporotic bone, but she may not. Then you'd have to go into her history. Young lady has had an eating disorder, bulimic, anorexic since she was 14 years old. Right? She's been anorexic. So a young lady is 39 years old, has a spontaneous fracture at her hip. She comes into the hospital with a spontaneous fracture at her pelvis or her hip at 39 years old. That is really young to be having a spontaneous fracture, right? She was walking down the street and collapsed because her bone broke. Okay. That is weird. And that's not normal. So you have to ask her, do you have anything in your medical history that would cause you to have had this spontaneous fracture? And again, she's never going to own that she's had an eating disorder, right? Like, no one's going to just come and say, I've had a raging case of anorexia since I was 14. And then you look at her and you say, okay, this lady's really, really thin. Have you had any infections, or are you dealing with any autoimmune diseases that could be causing you to have osteoporotic bone? No. Bam. Have you had an eating disorder at any time in your history that we're unaware of that could be affecting your bone structure? Well, yeah, Nurse Zakia, I have had an eating disorder since I was 14. There's your cause. That makes sense. Now
Yes.
the symptoms come together. You're not dealing with an athletic person who has low bone mass, athletic, dealing with someone who has low bone mass as an adult because they had a disorder. And now you're going to treat that a little bit differently than the old lady who had lived a normal life and she just osteoporotic because her bones are wearing out. That's a little bit different than someone who's young who has osteoporosis, because the person young has a life with bad bones. An old lady, she's going to die. Like, she's close to being dead anyway. It's, that makes sense.
Yeah. Yeah.
So that's it. I'm done. I kind of beat that to death, but I wanted to make sure that you were aware of where my thought process was and why I was talking that way.
Yeah, so it's like it's good to put it in an example, because, like you said, there is no like hard line. Oh, what happened? This will happen,
Yeah. Okay, you ready? Okay. Number 2. Let's go. You read number 2 for me.
Okay, rheumatoid arthritis is differentiated from degenerative arthritis in a 39-year-old woman by all except.
So what's this question asking us to do?
To highlight the sign of symptoms of rheumatoid arthritis.
It's asking us to compare rheumatoid arthritis to degenerative arthritis, right?
Yeah.
Okay. So let's ask us some questions then. So what do you know about rheumatoid arthritis?
Okay, so what I remember from yesterday, that rheumatoid arthritis is disease that like is inflammation in your joints.
Yep, it's definitely inflammation in the joints.
Yeah, and the degenerative arthritis is I think it's autoimmune disease.
Okay, you got that backwards. Rheumatoid arthritis is autoimmune based, and degenerative arthritis is usage based. It's when we overuse it, when we overuse a joint or use it too long. Well, let me ask you a question. Looking at this question, how old is the patient that we're dealing with?
39 years old.
So 39 years old. So that means they're younger than me, right? They're a little bit younger than me. And based on your age, this person's just a little bit older than you, I would imagine, right?
Yeah.
Okay, are you suffering from raging cases of arthritis?
Mm-mm.
Okay, so this is clearly a situation where a 39-year-old has an autoimmune disease of rheumatoid arthritis, and that's where they're getting their swelling from. So they're saying, hey, listen, you got this 39-year-old woman, she's got rheumatoid arthritis, but can you explain the difference between rheumatoid arthritis and degenerative arthritis? Well, we already identified one. Rheumatoid arthritis is autoimmune based, right? Anybody of any age can get that because it's in their genes, and then they get a stimulus and it responds, right? Okay. Degenerative, who are we going to see getting degenerative arthritis traditionally? Who's going to get degenerative arthritis?
So if that would be overused.
Yeah, overuse. Well, how do you? So is an 8-year-old child going to have overuse degenerative arthritis usually?
No.
No. So we would expect to see this in older adults, someone maybe geriatric in their 60s and 70s. We're going to see degenerative arthritis in our 60s and 70s. So this patient's way too young for degenerative arthritis. Okay. So now that we've identified the two kinds of arthritis and what we're dealing with, let's look at our answers and see which ones make sense and why they make sense. Okay, so A, what's A say?
Arthritis with swelling of 3 or more joints.
So we know that arthritis, rheumatoid, and degenerative arthritis are both swelling at the joints, right? They both have swelling at the joints. But what's the key phrase in A that tells you which side it belongs to, either rheumatoid or degenerative? What's the key part of that answer that tells you where it belongs?
Okay, so arthritis with swelling of 3 or more joints. 3 or more joints. That's mean like it's limited to like some certain areas.
Well, no. What they're saying is, hey, Zakia, you just developed a raging case of arthritis in your right ankle, in your left hip, and in your right elbow. Well, how are you going to have overuse in those 3 joints like that? How would you have an overuse injury in your arm and then have the opposite hip involved in that and the opposite ankle? Does that make sense?
Oh yeah.
But they all developed at the same time. Well, what would cause them to get an arthritis in 3 different joints across their whole body on the same day?
Okay, so that would be rheumatoid then.
That's going to be rheumatoid, right? Because only an autoimmune response at the genetic and cellular level are going to cause that response. So A belongs to rheumatoid arthritis, where degenerative arthritis, how is degenerative arthritis going to show up?
So according to what we say, and that's mean that this one will start and go in the same direction, I guess.
Yeah, so let me use a good example. So I get pain in my left ankle, right? I get pain in my left ankle. So there's a possibility that I'm developing arthritis in my left ankle. Well, based on it being usage, degenerative use, what would be the next joints associated with my left ankle that I start to develop arthritis with my left ankle?
So if you put on your left ankle, that's when you get in your left knee?
Yeah, it would be in the joints immediately around that joint. So as the left ankle starts to degrade, the left knee is going to start to degrade because I'm going to be favoring that side. I'm going to be making up for the fact that my left ankle is becoming weak. So my left knee would pick up some of that slack, wouldn't it?
Yeah.
Excellent. What else? What else would start to break down?
What else will start to break down? What's like above it? That will be your left
not just above it, but what's next to it. If my left ankle's getting arthritis, does that mean I walk a lot and I run a lot?
Oh no.
Yeah. So if my left ankle's engaged and starting to get arthritis, guess what my right ankle's probably doing?
Will it start to do the same?
It's going to start to do the same thing because I walk on both feet, don't I? I don't just walk on one foot. I walk on both feet.
I thought that would go like this clockwise, but no. They're like together.
Yeah, you have to. So if I get, so let me ask you this question then. If I started to get arthritis in my left knuckles of my fingers where my digits attached to my hand, I'm getting arthritis in my left knuckles. What would be causing me to get arthritis in my left knuckles?
So if you rheumatoid arthritis, you like, we're not sure now because
not of that. Not rheumatoid. This is degenerative now. I'm getting arthritis in my left knuckles. What would be causing me to get arthritis or overuse damage in my knuckles of my fingers?
Using of your laptop?
Yeah, I could be typing a lot, right? So I could be an office worker. Well, do we all type with one hand?
No.
So if I'm getting arthritis in my left hand, where am I going to most likely see arthritis for the next round when they come in?
That will be your right hand.
I'm going to be looking at their right hand because they're going to start compensating keystrokes with their right hand to make up with the paralysis and the pain in their left hand. Does that make a little bit more sense now?
Yes.
That's how you can identify it's not rheumatoid, because rheumatoid is going to innervate and attack whatever joints autoimmune that they hit, where degenerative arthritis is based around that joint, and then it's going to move from that joint around it, and as the other joints and the other muscles and the bones go to correct and help that joint out, the other ones start to get overused more because now we're favoring those, and they're gonna break into arthritis quicker themselves. Did we beat that one to death?
Yeah, we did.
But that was important because that would be really easy to miss that because, oh, well, degenerative, yeah, they could have arthritis in 3 or more joints. Absolutely, they can, but it would have to give you more details than saying, hey, this 39-year-old is a marathon runner. Since she was 15 years old, she's been running marathons, right? Well, that would make sense. At 39 years old, she's put some miles on her feet. She's got left ankle arthritis. Oh, now she's got right ankle arthritis. Oh, now she's got right knee pain. See what I'm saying? That would make some sense. That's not autoimmune. That's overuse. She just runs a lot.
Okay.
Okay, we good?
We're good.
Okay, B.
Genetic predisposition for joint inflammation. Okay, so it's just from the genetic and joint inflammation. That will be rheumatoid.
It's genetic, so it's rheumatoid, correct?
Yes.
Okay, let's look at C.
Damage to cartilage resulting in loss of joint like padding through overuse. So if that would be overuse, that will be the degenerative
Yep,
arthritis.
degenerative.
Mhm.
Okay, and
Okay,
then what's the last one?
can be treated with infliximab. So MAB is an anti-immune drugs. So that will be rheumatoid.
Yep, rheumatoid. Now, 3 of them are rheumatoid, and 1 of them is degenerative, correct?
Yeah,
So what's the correct answer for this question?
that will be C because it said all except. So
Except that one. Yep, perfect.
I,
Okay, I'm going to
yeah,
jump down to question 30 just to see them, because I've seen 1 through 5 already like 4 times with other people. So I'm going to jump down to question 30 and work backwards now. Is that okay? Because I'm going crazy seeing the same ones.
you're going okay,
I'm
go.
going stir crazy seeing the same questions all the time. So question 30 says systematic lupus erythematosus, or whatever it is, SLE, is a chronic inflammatory disease that can affect virtually any organ system, including the musculoskeletal system. Lupus is characterized by which of the following? Select all that apply. So
Yeah.
my answer, ones that I picked, you can tell me what you pick because I don't think I got them all. I got A, symptoms can be managed with steroids and autosuppressant drugs. Okay, that was one that I chose as select all that apply. I select
Okay.
C, Epstein-Barr virus can be epigenetic trigger for lupus.
Yeah, that's in that.
Yep, and then E, facial redness called butterfly rash.
That's also in the outline. So symptoms can be managed with steroids and immune suppressant drugs. I know lupus is like autoimmune based too, right?
Yeah. But look,
Yeah,
what's the magic word there that they use? Symptoms can be what?
managed.
They didn't say cured, right? They didn't say get cured. They said, hey, we manage it. So this is palliative care. We're not going to cure this, but we can give them steroids and immune suppressant drugs to decrease the symptoms and make the person's life a little bit better. But we're not going to cure this.
So for us, we put D as well, like the formation of auto antibodies and immune complexes.
And so why did you guys put that one for lupus? Because I kind of vacillated on that. I'm kind of curious. Can you tell me why you picked that? Now it's your turn to teach me.
So yeah, so yesterday, I think I don't remember her name, but she's always 1-to-1. She's the one who pointed out from the book. So because your immune system will be suppressed, so you have this immune complexes will form. That's one will elevate your inflammation.
Okay, so you're saying so when your immune system is impaired because of lupus, it's
Yes.
you're gonna cause more auto antibodies to form and immune
Yes.
system complexes to form. And that's just gonna aggravate the lupus.
Yes. So that's the reason why we picked that, and because your antibodies will really attack your
Okay, that
antibodies.
makes sense.
Will
That
attack
makes
itself.
sense.
So
Okay.
that's the reason.
Okay, we
Okay.
good?
Yep.
29.
Uh-huh.
Go ahead,
So
do 29.
Yeah, so Miguel has been diagnosed with the muscular dystrophy. Muscular dystrophy? Okay, so
Yep.
what the early signs should his parent watch for that will indicate the disease is progressing? So with this, we spent like almost 20 minutes. Like we said, like wheezing and like wet lung sounds, but that would be a signs.
That's a longer term sign, right?
Yeah, and then they didn't say like when we Google it, like at least they will have this wheezing and wet sign, like wet lung signs, and when your child is like 10 years old, and then this is like genetic based. So
Yeah, muscular dystrophy is like an autoimmune disorder, right?
yeah, so it's like how I said it's like would be I was convinced it's A, and then because I didn't go over the notes, like what the note says, like early sign will be increased calf muscle. It's like okay, why we like overthinking that? That will be increased calf muscle size. It's just because it's the early signs. They didn't say anything about age in this question.
Yep. If they've given us an age, then we would have been able to narrow it down a little bit quicker.
Yeah, yeah. So cognitive decline and confusion, that would be late sign.
Yep.
The hyperactive deep tendon reflexes, I think that's also will be like a late sign.
Yeah.
Okay, so that's how we just, okay, is B is increased calf muscle size.
Okay, let's go up to number 28. So so a patient returns to the clinic after taking a 7-day course of antibiotic therapy and is still exhibiting signs of localized infection on his ankle. What should be the nurse's initial action? Arranged for the physician to order a different antibiotic, obtain another wound culture swab to send to the lab, determine if the patient took his medication as prescribed, and make an appointment for the patient to be seen by an infectious disease specialist. I put A, arrange for the physician to order a different antibiotic. What did you put?
No, we put B, obtain another wound culture swab to send.
So why would we do that? Why would we obtain another culture from this one?
Okay, so this patient will be taking those like antibiotics for 7 days. Okay? Yeah. For 7 days. Oh, you moved the question, man.
No, I'm sorry. I'm just marking these ones because I want to mark your answer so I know how you answered and what I answered. Does that make sense? So when I go back and review, I can review in my mind why your answer was correct. If that makes sense, it'll force me to see what I answered originally, and then it'll force me to see your answer, and then I'll go through the mental dialogue of answering why I answered the question wrong and why the right answer was right. I'm just making myself do that.
Okay, then text me so we can all take the test and see what we did. But if you have different, let me know.
No, I do. That's mine are the other ones. That's why I'm marking you. So I think you're right. And again, some of these I struggled with, and I had to pick between the two because I thought that doing a swab would be right, but I wasn't sure if that makes sense.
Okay, so Howla, she's the one who pointed out. And she said, like, if this antibiotic didn't work, so there's something wrong. It's either the doctor or like the physician give them like the wrong antibiotics. Like they need to take another type of antibiotics, you know? And since it's been taken there for 7 days and didn't do any effect, that's mean that they just need a different one. So how we can get the correct one?
So you do a culture, find out what the bacteria is. And
yes.
Then you find an appropriate antibiotic based on what your culture tells you it is.
Exactly.
Okay, that makes more sense. Okay.
Yeah, so it's still exhibiting the same signs of localized infection on his ankle. So what should the nurse initial action? So that will be the initial action is. It's like if they already, you have an infection, your body on fire, and they said, okay, this is what happened. When you've been taken for 7 days and nothing changed, that means that there is something wrong. It's either your body is not accepting this antibiotics or there is something else. So this will fix that.
Okay.
So, yep.
Okay. Let's move up. 27.
Yeah. So which of these statements is related to fat embolism? So our topic is the fat embolism.
Well, and it's fat embolism and fat embolism syndrome or FES. Yeah. So it's both. It's asking us about both.
Yeah. So for somebody who didn't go over the notes, it's just review with the people. Like we Googled everything, and we have one or two like just look over the paperwork. So for 27, we had the right like P and E.
Okay.
So with the syndrome, the FES is more frequent in open fracture injuries. That's wrong because it's
closed. Yeah, closed fracture.
Fracture, right? And then fracture of long bones are more likely to cause the FES.
Yep, that's true.
Yeah, and then single fracture are particularly susceptible to causing fat embolism. No, it's multiple fractures.
Yep, multiple fractures are better. They're going to get it, okay?
Okay, and then affected organs are lung, heart, and kidneys. So I think we looked at in the outline, but the kidneys wasn't involved with the fat embolism.
It's just the lungs and the heart, right?
Yeah, so the lung, the heart, the kidneys wasn't. Mama, what the such way? What this way was? Okay, so yeah, so the kidneys is not involved. So that's why we eliminate that one.
Okay, and I had that as a question. That's why it's gray. I said, hey, man, I had some questions about that. Okay, thank you.
Yeah, And we can look at it again and
No,
double
you're
check.
okay. No, I trust you because I looked it up and I couldn't make
Okay.
heads or tails of that. The yellow ones I definitely could make heads or tails of. I could figure those out. That's why those are marked yellow. Okay. Thank you.
Okay. So the last one will be the majority of fat embolism episodes occur as a result of a major trauma. Yes.
Okay. Yep. So it's B and E is what you got.
Yeah, B and E.
Okay. So 26, the nurse must assess how well the parent of a child diagnosed with Duchenne muscular dystrophy has understood the discharge instructions. Which of the following statements is by the parents indicates that further teaching is necessary? I put A. I will schedule regular physical therapy to stop his muscles from deteriorating. Once muscular dystrophy starts, there's no way to reverse it. So the parent clearly doesn't understand that their kid's not getting better.
Okay.
And then I will monitor my son carefully because I know he's at greater risk for lung infections, which is true. They are at greater risk of lung infections because the muscles are breaking down. They don't move air as well. They don't move phlegm and different fluids in and out of their lungs as well. It is expected that his symptoms will be worse on some days than on others. No, he's going to have symptoms, and his symptoms are just going to get progressively worse over time. If his symptoms get better, that's an indicator of like arthritis. Arthritis is going to have days that feel better or worse. But this muscular dystrophy, once it starts, they're going to be muscular dystrophy, and that's it. And they're going to just progressively get worse until they die. I anticipate my child will need to be evaluated by a cardiologist, and I don't know why the hell you'd have your kid evaluated by a cardiologist, at least not straight away. So I said A. I will schedule regular physical therapy to stop his muscles from deteriorating, and A is the incorrect one.
Yeah, so for us also is A, yeah, because since that start will not stop.
Yeah, once it starts, it's not going to stop. Okay, what about 25? You want to take this one?
Yep. So several hours after being admitted to the ICU for a head injury, so we have a head injury, the nurse noticed that the client is more lethargic and confused. So, okay, before I finish this, so I get what confused is, but I cannot get lethargic.
Lethargic means they move slowly. They have uncoordinated, slow movements.
Uncoordinated, slow movement. It's not like they are like I see lethargic as just like more confused.
Well, let me ask you a question. Have you ever woken someone up who didn't want to wake up? Like say a little kid. Like like kids when they get ready for school in the morning, do they really want to get up?
No.
Okay, they kind of move slow, they stretch out, they yawn, they fart around, they roll around on the bed a little bit, and then they fall back to sleep, right?
Yeah.
Unless you are literally there kicking them out of bed, they fall back asleep. That's lethargy. That would be considered a lethargy. That'd be lethargy. They're lethargic. They're moving slowly. They're dragging. I don't want to say that word. I was going to say dragging a. They're dragging their feet. They don't really want to do it. Okay. They're clearly just want to stay in bed and sleep all day. And that would be lethargy, right? That's slow, uncoordinated movements. And then confused is just confused. They're mentally confused. They can't put their thoughts together and coordinate their thoughts. So their body action and their thoughts are both slow and uncoordinated.
I see, because like he's in the ICU, so he's sleeping, lethargic. Like what? He's in the bed. Like what? Lethargic.
When he wakes up, for example, a good lethargy action is really, really slow, uncoordinated head movements, right? So like there's a noise in the room, and they'll have a really discoordinated movement to move their eyes to look at it. Does that make sense? Like their head will roll, and instead of looking right to the target, that's where the noise is coming from, their head will roll down to their chest, and then up, and then to the target.
Okay.
So their head looks kind of heavy, right? It looks heavy on their neck. And so that's lethargy.
I see. Okay, thank you. So they're more lethargic and confused, is mumbling in her speech, and is very difficult to arouse.
So that's part of lethargy, right? They're difficult to wake them up. And that's the lethargy tag. Lethargy is hooked to that, where mumbled speech is hooked to confused, right? Those two go together, and lethargy and very difficult to arouse go together.
Nice. Okay. So the nurse takes which priority action?
Okay.
So A is assess the patient's blood pressure for shock.
Hold on just 1 second. Hey, Addison, how are you?
Good, how are you?
Good. Did you get my email to get online?
It said get online at 9:30.
Yeah, we're online right now. You gonna get on? Yeah, Zakia's on here with me. We've just been going over 11 and 12.
Okay, well, I'm just driving home, so I'll be home at like 11.
Well, let me do this. I am going to finish up with her in like the next 10 minutes, and then I have to get some sleep today. So let's just do this.
Okay,
Let's just call it a bye. And then tomorrow, do you want to meet tomorrow morning? Can you meet tomorrow morning?
Yeah, I have a doctor's appointment at 9, but I can meet you at like 10, 15 maybe.
Okay, well, we'll just meet at the library then. That library over there in Rose Park. Just meet me at that library,
Okay.
Day Riverside at 10 o'clock or 10:15.
Sounds good.
Okay.
Okay,
Have fun. Yep. Bye. Okay, I'm back with you.
Okay. So so I don't think that she has any symptoms of shock, but there's like blood pressure for shock.
Well, ask yourself this question: what's causing this patient to be mumbled and confused in speech and lethargy?
I would think that.
Where's that happening at?
So, okay, they might have, because if they have a heart attack, they will be in pain and panic.
Think back to our lectures. This has nothing to do with musculoskeletal. This question is a review of a different section that we've already studied.
Yeah, so that's why I'm thinking like why she would, but you know what? It's make more sense now. So yes, I will assess the patient blood pressure. As I don't think this has a shock, but I will assess their blood pressure.
Okay, so let's ask ourselves a question. Think back to your neurological section, section number 9, I believe it was, unit 9. And if they have lethargy and confused with mumbling speech, that means there is intracranial pressure on their brain. They have fluid on their brain, and it's getting worse. They're losing the ability to speak. They're losing the ability to compose their thoughts, and they're having slow, uncoordinated movements. That is intracranial pressure that's causing that.
Yeah.
So
right.
what action would I want to take to reduce that intracranial pressure in their brain?
You need to give them the mannitol.
Yeah, I want to give them either mannitol. Well, I don't want to give them mannitol would work because that's hypotonic solution, right? In this case, they don't give me the choice of giving them mannitol, but they do have there is a hypotonic solution there. So they're at 0.9. That's normal. I want to give them oh shoot.
It's hyper.
I want to pull the fluid out of the brain.
Yes.
So you're right. That's hypertonic. So hold on. Anticipate changing the IB from 0.9 to 0.45. So that's not going to be right.
Yeah.
That's hypotonic. That's going to draw fluid into the brain, and it's going to make this worse, correct? So I'm wrong. I chose C because I read it backwards. I would need 3% normal saline.
Yeah. So yeah.
That's backwards. I'm going to read
the answer yet. So B, make sure suction equipment is at the patient's bedside. Suction?
Yeah. Remember, if they're having difficulty, so if they've got pressure in their brain, they're going to do what next? They're going to have pressure on what next?
In their brain, that will be lung?
Their cranial nerves are going to have pressure and they can throw up. Remember, in every single neurologic injury, it was loss of consciousness, vomiting. If they vomit, what's the likelihood they're going to vomit? They're going to vomit. Where's that vomit going to go?
Yeah. So
it's going to go in their airway. And so that's what the suction equipment's for, is to pull it out of their airway, to give you the suction equipment to get that vomit out of their airway. So checking their blood pressure, what does that do for them immediately? So you check their blood pressure and it's out of control. What does that do for them right now?
Okay, so if they have very low, they will just put the fluid in, and that will be a hypertonic. So they will get their blood to raise their blood pressure.
No, I'm just saying. So look at the answers that they have, right? A, B, C's: airway, bleeding, circulation, right? Airway, breathing, circulation.
Okay, wait. Airway,
breathe, circulation, right?
Yeah. So
is checking their blood pressure do anything for their circulation?
No.
It just gives you information about their circulation, but doesn't do anything for it. Okay.
Yes.
But suction equipment, what would suction equipment help me do?
clear the airways.
If they throw up and they occlude their airway, A, this gives me the equipment to be able to treat an airway obstruction.
Yeah.
So B is definitely in the neighborhood. C is not right because of why?
Because those all hypotonic solutions.
It's hypotonic, and that's going to draw fluid into the cranial tissues.
Not all of them, just the
worse.
45 and the saline. So
yeah,
like,
it's gonna basically make their cerebral edema worse, and it's gonna kill them. It's gonna make their slurred speech and difficulty breathing. They're gonna fall asleep and not wake up. It's gonna make that worse. We're gonna make that worse with C. So I was wrong. I read that wrong. I read the answer wrong. And then contact the family to arrange hospice care. Well, what's that gonna do for them?
Contact the family to arrange. You will kill the patient. Like you don't do anything.
They'll be dead before they get to hospice care. No one cares, right? The patient will be dead unless we do something now. So I believe the correct answer for this one is B.
You know what?
Get that suction ready.
This is 25, right?
Yes.
So we put A, actually.
So you guys put it. I'm going to mark this one. I'm going to go to Tana, and this is one that I'm going to send to Tana and Megan and ask for some help on.
Yeah, I don't know why.
I don't agree with that. I think this one is B because two reasons. One, I distinctly remember neurologic injuries telling us to keep suction equipment nearby. Because okay, so you check their blood pressure, and so say they're in full blown raging shock, right? Well, now what do you do?
But like, okay, so you need to assess this. Like, you need to assess it anyway. So this is the first thing you will do because you will not jump to B without knowing A.
Hold on, though. Look what it says. It says the nurse takes what? Takes which priority action? You are not going to ever assess blood pressure until you know their airway is not occluded. In any emergency situation, you're going to go airway, breathing, circulation. A and B are both actions from answer B. Having the suction equipment ready is going to keep their airway from being occluded, and it's going to also help you open their airway so they can breathe. But all B does, look at the last word in A. Look at the last word in A. What does A say?
Shock.
Shock. If they're in shock, what's the number one thing when someone goes into shock? Are we able to pull them out of shock every single time?
No.
Okay, so again, depending on what kind of shock it is it compensated shock? Is it uncompensated shock? If it's uncompensated, they're going to die anyway. There's nothing you can do for that. Does that make sense?
Okay.
So again, let's do this. Let's not you and I get into a discussion about it. I think we've discussed it enough. Let's just do this. Let's send this question to Megan and to Tana and ask them to explain it to us. Because clearly, I think we both have a very, very good argument on this.
Okay, great.
And I think let's get their final bless off, and then they can point us in the right direction on the answer, and then we'll both be unconfused. We'll know what their final bless off is, and we'll be better off.
Okay, great.
Okay, is that fair?
Yeah.
I think what you're saying is absolutely true, but they're so doggone close, right? They're so close to being right. I mean, I'm with you. I would absolutely check this patient's blood pressure. Does that make sense? I would absolutely do that, but I'm going to do that after I open their airway and I make sure they're breathing appropriately.
Okay, nice.
Okay, we good? Yeah, I've already marked that in that nasty brown. Okay, let's do one more question. We'll be done for the day because I'm tired and I got to go to sleep.
Oh my God. Okay, let's do.
I know I'm horrible. I know.
Okay.
The nurse is performing a medical history and physical assessment of a client. Which assessment findings would lead the nurse to conclude that the client is at risk for osteoporosis? Select all that apply.
Okay.
Go ahead. I'll let you read and answer these, and I'm gonna let you do it, and I'll see if mine match yours.
Okay, so risk factor. So Caucasian woman who is underweight, yes, for sure. Survive breast cancer after 6 weeks of chemo, yes, because chemotherapy will damage your the most fast growing cells.
Yep.
C, drinks at least 4 cans of Diet Coke, of course, because of carbonation. Okay, walks her dog a mile and a half 4 times a week. Nope. And then is undergoing treatment for GERD. Doesn't relate it.
That's totally unrelated, right? GERD is not even related to osteoporosis.
No. I don't know.
Gastroesophageal reflux disease.
Oh.
That's what a GERD is, and that's got nothing to do with your bones.
Okay, so ABC, that's correct, and we got the ABC too.
So you got it, and I got it. Okay, cool. Can we finish there? I know you don't want. I know you don't want to, but I'm going to because I'm tired.
You're a great teacher, Chris, but yeah, you gotta sleep. It's okay. Like
I had to work last night, and I got to work tonight as well. So
yeah. So yesterday when you said like if nobody like replied to me because I saw your note, your text after 5:30, and I said like since nobody did that, it's like oh he needs to sleep. So I didn't text you.
No, I'm happy. I won't volunteer a time that I can't do it. But again also like it's a holiday for everybody, right? I want to go see my family today too. That makes sense.
Yeah.
And so I'm trying to navigate around seeing my family and studying with you guys and taking care of the team. And so I'm happy to meet with you guys and do this online thing. Is this, can you hear me better?
Was that?
Can you hear me better than you have in the past?
I think so, yeah. And
okay, I got a headset now with a microphone on it, and I'm at home, and so now I've got all my bells and whistles, right? You can see, you notice I haven't had any problems today with getting the slide deck to work.
Mm-hmm.
Because I'm at home and I have a second screen and I can see what the heck's going on. So I'm really excited. So I love actually doing study group from home now because I got my desk all organized and I can do this really well from home, which is awesome.
Okay, nice.
So I can't always do it from home, but it is nice to have my clicker working, the laser pointer, how the little circles were moving. You can see where I was talking about.
Yeah, great.
It's really fun. And you can actually, and then you can see me scrolling it up and down. I can go, oh, this is this question right here, and you can see what I'm talking about. So
tomorrow, just like to be better prepared. So tomorrow, which like sections that you will go over? So I will go over the reproductive today, my notes.
So I will tell you right now, Zakia, after today, we need to be getting into 9, 10, and 11 review for the test. So okay. I am going to get away from 12, and I'm going to go. I mean, I might go over 12 to finish the questions.
Let me finish. Let's finish tomorrow. Yes. No. I mean, like, let us finish the questions tomorrow. So we will be like, first, you need to send that email so somebody can reply to you. Second, let's finish this, and then just let me which section that we will go over tomorrow. So that will be more productive, and it's like we can like go faster in the chapter. So I can go over the chapter that we can go over it tomorrow.
Yeah, just make sure you go over unit 9, 10, and 11, 9, 10, and 11 for the test for Tuesday. I'm getting into 9, 10, and 11 review for the exam.
Okay.
Because we only have 4 more days before the 11, exam.
I don't know if I will finish the 9 and 10, but I will. That's okay. So I will start with 11 and see what will happen.
Okay, you good?
Yep. And tomorrow we need to finish the test question. Don't forget.
Yeah, we got to this too. But again, we're kind of number 12 isn't due until the 8th, right? So now I'm saying, okay, in lieu of being ready for 12 early, I want to be ready for the exam on Tuesday.
Yeah. So our Tuesday. So the Tuesday will be 9, 10, and 11.
Yeah, that's the exam on Tuesday.
Okay. Yeah, I just want to make sure that I get that right. Okay.
That's why I'm saying we kind of need to pull back off of unit 12 now and just do unit 9, 10, and 11 review for the test.
Okay. Sounds great.
Okay. Have a good day.
You too. Bye.
Bye.